You're listening to a podcast from the BMA.
Hello, I'm Neil Hallows from BMA News. Have you ever wondered what would happen if surgery was carried out according to the rules of the Eurovision Song Contest? Well, so have I.
Will divide through as long as you've gone sort of deep enough in the centre.
Entonces, lo va a dividir siempre y cuando hayan tenido un surco suficientemente profundo en el centro.
And then you can see, you won't be able to see that it's divided right through in the centre at the back of the nucleus, the nuclear plate.
Y entonces ya se puede ver cómo está dividido en el centro del núcleo.
That was consultant ophthalmologist Brian Little, working in much the same way as he does in his day job at Moorfields Eye Hospital in London, except that he was 7,000 miles from home, working at a fraction of his normal pace because of the need to explain and translate his every move for a live audience of Peruvian doctors. Ah yes, and he was working on a converted plane. Mr. Little was volunteering with the eye charity Orbis, which restores sight, trains medical staff and boosts capacity in dozens of developing countries around the world. The charity is most famous for its plane, a converted DC-10 called the Flying Eye Hospital, which has a fully equipped operating theatre. But its volunteers and staff also work in local hospitals, where as well as imparting skills, they identify sustainable and realistic improvements to the delivery of care. Mr. Little, the veteran of 7 Orbis programmes, still finds the experience of a new country jarring but invigorating.
It's unsettling, but then you get used to being unsettled and you know that that feeling passes, and you just have to stick to the basic principles of keeping things under control, really.
There are lots of eye charities which perform amazingly high volumes of surgery, especially cataract operations. Orbis, instead, focuses on the multiplier effect of education. It informs everything it does. Patients, said Mr. Little, were chosen according to the training needs of local doctors, and lists were kept small so that new procedures could be carefully observed.
The idea of coming here is not to operate on as many cataracts as you can, but to choose the cases very carefully for their educational content, because primarily our objective is to train local ophthalmologists in their own environment with their own equipment, ideally.
Those patients not treated directly by Orbis would have their treatment funded by the charity in the local hospital. The patients would often speak of the doctor's arrival as a gift from God or a miracle, and of course what the Orbis doctors were doing, what any doctors do, would have had water into wine status not so long ago. But if you delve a bit more deeply, you realise that the miracle is as much about the delivery from serious debt as it is from blindness. When Tito Acosta Pastor, a 53-year-old man from Trujillo, developed a cataract, it compounded his existing vision problems, and when Orbis arrived, he could see little more than the hand in front of his face.
En referente al trabajo, estoy de licencia a la fecha 5 meses, porque
I'm on sick leave from work at the moment. I've been off for 5 months now. My sight became worse and I can't see the computer anymore. I'm an accountant doing accounts for 2 businesses and a family, and I've not been able to carry on working anymore. As for how it's affected my family, it's been very worrying, because I'm the head of the family. I have a household with 6 children, 2 of whom are still at home with us. It's very worrying for them, because it's the first time I've ever been ill, and my sight's getting worse, and I'm not able to go out to work. My wife thinks that I'll never work again, and I'll never see again.
Stories like this are quite a motivation to work for Orbis, but there are other attractions too. There's a sense of teamwork, summed up by another volunteer who was in Peru the same week, Simon Courtman, a consultant anaesthetist in Plymouth.
You've got to have a very good team of people who are able to work in challenging conditions and make challenging decisions and adapt and overcome obstacles that are in their way.
And they have to adapt to a great deal, to jet lag, a different climate, the language barrier, the occasional political coup, and perhaps even more unsettling, to materials that would have been passed over at home years ago. Now, this is a charity which aims to spread best practice in its partner hospitals, and not to perform the kind of heroics with elastic bands and teaspoons that you sometimes hear about in anecdotes about student electives. Anaesthesia, for example, cannot be practised safely without a certain level of equipment. Although the hospital in Trujillo was relatively well equipped, some places where Dr. Cortman has volunteered have lacked such basics as an oximeter or pulse monitor.
You have to be adaptable up to a point, but that's the safety line where you say, actually, we're not going to do these cases here. We're going to do them on the plane.
If this decision is made, the aim is to make it well before the doctors arrive. Detailed site visits are carried out before each programme, and Orbis often has a long-term relationship with hospitals where it funds or recommends equipment purchases and technical training. But between the extremes of the hospitals with nothing but mattresses on the floor and the miniature cathedral of Western medicine that is the plane, there is a judgment to be made. Every doctor who works for Orbis has to make it. They have to ask themselves how much of the way they practice is about comfort and reassurance, and how much is really vital to patient safety. The answer can be inspiring. Brian Little.
My general experience is that people in developing countries are extraordinarily resourceful with what limited resources they have.
Yes.
And they, I'm humbled by what they can do, particularly surgically with the instruments they have. If I turned up to work at home and was offered the instruments that these guys have, I would probably throw them back and say, I can't possibly work with these instruments. You see these people performing very competent surgery with them.
The professional insights that doctors get from working for Orbis are clearly great, but we shouldn't forget, just as they certainly don't forget, why they are really there. In fact, does the question, what attracts you to restoring people's sight, doctor, even need to be asked? If it does, then Amna Noor Al-Galas, an ophthalmologist working for Orbis, has a very good answer.
It's when you see the smile, a genuine smile on the face of a complete stranger who's sending you good thoughts and good wishes and praying God for you to bless you and to have success, although he doesn't know you. I think that's amazing.
Brian Little, who does a bit of conjuring in his spare time, says that eye surgery is the closest he gets to real magic. And even though we know how it's done every time, it's still wonderful. This is Neil Hallows reporting for BMA News with thanks to Seren Boyd, Fiona Edwards and Mike Foster.